This is a summary of Dr. Paul Conti, Tools and Protocols for Mental Health, where we break down the key insights, ideas, and takeaways from this content, giving you the gist so you can decide if you want the rest. In this fourth and final episode of the Hubermanlab guest series with Dr. Paul Conti, the discussion centers around self-care, mental health protocols, and the importance of fostering a structured, actionable approach to improving one's mental well-being. Dr. Conti defines true self-care as more than just pampering, relaxation, or physical health routines. It is about constructing a life narrative that helps us frame the past, present, and future in ways that promote clarity, resilience, and growth. This episode covers how to recognize and address mental health challenges, practical daily protocols for self-care, the role of therapy, journaling, meditation, and other reflective practices that strengthen mental resilience. The discussion explores the true definition of self-care, why it is more than just rest and relaxation, the importance of life narratives, how constructing a personal story can clarify challenges and help navigate future obstacles, the role of therapy and self-inquiry, why structured self-exploration leads to mental clarity, journaling and storytelling as mental health tools, how writing about our experiences reveals hidden patterns, the power of meditation and mindfulness, how they help process emotions and improve resilience, how to address past trauma effectively, and why ignoring trauma prevents true self-care, the importance of agency and gratitude, how cultivating these two elements leads to emotional stability, the dangers of avoidance and emotional suppression, how ignoring problems amplifies stress, how social relationships impact mental health, why surrounding yourself with the right people is essential for self-care, the role of sleep, nutrition, and movement, why foundational health habits are critical for emotional stability. What is true self-care? Conti emphasizes that self-care is not just about doing things that feel good in the moment. It's about engaging in behaviors that promote long-term emotional well-being. Key aspects of true self-care: understanding your past and present experiences. Examining how your past has shaped you helps create a healthier future. Building self-awareness. Recognizing emotions, patterns, and triggers helps prevent unconscious reactions. Practicing structured reflection. Journaling, storytelling, and self-inquiry reveal insights about personal growth. Addressing trauma instead of avoiding it. Unresolved issues continue to influence behavior until they are acknowledged. Maintaining foundational health habits. Sleep, movement, nutrition, and social connection all influence mental health. Key takeaway: self-care is an active, intentional process of self-discovery, reflection, and growth, not just temporary relief from stress. The power of life narratives, why your story matters. A central idea in this discussion is that the way we construct our personal life story influences our mental health. How to create a healthy life narrative. Write about your past experiences. Identify key moments of growth, trauma, and transformation. Recognize when your life narrative became distorted. Identify points where negative beliefs took hold. Challenge false beliefs. Many people carry inaccurate, self-limiting narratives that don't reflect reality. Rewrite your story with agency and clarity. Reframe experiences in a way that promotes growth rather than victimhood. Common distorted life narratives. I've always been this way. People often falsely believe they've never changed or improved. Will never get better. This creates a self-fulfilling prophecy of inaction. I don't deserve success or happiness. Feelings of guilt and shame prevent personal progress. Key takeaway: rewriting your life narrative with intentionality helps shift your mindset and empowers you to make positive changes. How to use therapy, self-inquiry, and reflection for mental health. Conti explains that whether or not someone has access to therapy, self-inquiry is essential for mental health. If therapy is available, find a therapist who challenges and supports you. Effective therapy is both nurturing and constructive. Be open to self-exploration. Therapy works best when individuals actively engage in the process. Recognize that discomfort is part of growth. Facing difficult emotions is necessary for healing. If therapy is not available, writing thoughts and feelings helps process unconscious emotions. Meditation and mindfulness, quieting the mind, helps access deeper insights. Talking with trusted individuals, engaging in meaningful discussions with supportive people fosters self-awareness. Structured self-inquiry, asking intentional questions about behavior, emotions, and past experiences reveals valuable insights. Key takeaway: mental health improves when we consistently engage in reflective practices, whether through therapy or structured self-exploration. Journaling and storytelling, a practical mental health tool. How journaling helps mental health: reveals hidden emotional patterns. Writing about experiences helps clarify recurring issues. Creates distance from intrusive thoughts. Writing thoughts down reduces their emotional grip. Helps process difficult emotions. Putting feelings into words makes them easier to manage. Strengthens memory and perspective. Reviewing past journal entries provides valuable insight into personal growth. How to start journaling for mental health. 1. Write about key life events. What experiences shaped your self-view? 2. Describe daily thoughts and emotions. Track patterns in mood and behavior. 3. Ask yourself reflective questions. Why did I react this way? What lessons can I take from this? 4. Use free writing techniques. Let thoughts flow without self-censorship. Key takeaway: journaling creates self-awareness, clarifies emotions, and provides a structured way to examine personal growth. The role of meditation and mindfulness in self-care. Meditation and mindfulness practices help regulate emotions, reduce stress, and improve overall mental clarity. Benefits of meditation for mental health: improves focus and reduces rumination, helps prevent repetitive negative thoughts, lowers anxiety and stress levels, calms the nervous system, and reduces emotional reactivity. Enhances self-awareness, encourages deeper introspection and emotional regulation, promotes relaxation and better sleep, increases overall emotional resilience. Key takeaway: incorporating mindfulness practices into daily life helps stabilize emotions and supports mental well-being. Addressing trauma, a critical aspect of self-care. Conti emphasizes that trauma must be acknowledged and processed to achieve true self-care. How to approach trauma healing. Recognize signs of unresolved trauma. Persistent anxiety, guilt, shame, or avoidance indicate unprocessed pain. Acknowledge past experiences without judgment. Avoiding trauma keeps it active in the unconscious mind. Seek structured self-reflection. Journaling, therapy, and mindfulness help process traumatic memories. Reframe trauma through a lens of growth. Shift focus from victimhood to resilience and strength. Key takeaway: ignoring trauma doesn't make it disappear. Processing and understanding it leads to true healing. Final takeaways: a roadmap to true self-care. Self-care is about self-exploration, reflection, and long-term emotional health. Constructing a clear life narrative helps shift perspective and promote resilience. Journaling, therapy, and structured self-inquiry help access deeper self-awareness. Meditation and mindfulness improve emotional regulation and mental stability. Processing trauma is essential for true self-care. Avoidance only prolongs suffering. Agency and gratitude are the pillars of mental well-being. Actively cultivating them leads to lasting emotional stability. Dr. Conti concludes that true self-care is an ongoing, intentional process that requires active participation, curiosity, and commitment to self-improvement. That's a wrap on Dr. Paul Conti, Tools and Protocols for Mental Health. If you found this summary valuable, make sure to follow, subscribe, and come back for more in-depth breakdowns of content.